There's no question healthcare is under tremendous pressure today. Obviously, with the reimbursement requirements, with the need to cut cost in healthcare, with the need to provide access to a greater number of our citizens than ever before.
Well, mostly today, with the economy the way it is, staffing is a big issue. Okay, the executives come back and talk about controlled expenses, and the one thing that you look at with controlled expenses, you look at staffing and you look at supplies.
You know, with healthcare, where it's going and how it's been going the past few years, you're always asked to do more with less.
We face challenges by just making sure that the nurses have what they need, the physicians have what they need to take care of patients, no matter what comes in the door.
Those multiple pressures create a circumstance to where we have no choice but to improve efficiency. And I think efficiency also requires to look at automation.
Going to the automated supply cabinets made it very easy. Everything is right there for them to see.
It helps us to have the supplies that we need on hand by simply pressing take, and that immediately gets our product re-inventoried. It helps safety, number one. Secondly, to be more efficient in the fast-paced environment that we are in.
In the intensive care units, they were the last ones. They didn't really want them. They just felt they needed to be able to get to their supplies as soon as they can. And it probably took them about 3 days. They love our cabinets. I don't think I could ever take them away from them at all.
They can store information and they can connect to our network. And this evolution has probably been more of a revolution.
Access to information is virtually instantaneous, and it's actionable information.
It shows exactly what charges were done. It gives you a time. You can go back and track it down to the hour, the minute, and actually the second if you want. For insurance purposes and audits, it's awesome.
We find the technology has allowed us to improve patient care at bedside. It's allowed us to better align ourselves with our physicians' interest, and it also now has created the opportunity to be able to go out and tell how we've made improvements.
Supply costs actually went down. On the other hand, our revenue increased. We showed about a 40% increase in revenue capture in just the first 3 months.
With CareFusion and, I guess focusing more on R&D, you're bringing in the best equipment. Because that's the number one thing. You have to have the top equipment when you're dealing with patients.
We know them on an individual basis. They're a part of our family. Actually, they're here a lot. They're very helpful. Just like I said, we have their cell phones on speed dial.
We found a company who said, we want to make the product work for you. We want to find a way in which we can help you improve performance in your facility.